Hello, in this presentation, we're going to talk about the use of a generative AI multimodal, multilingual chatbot for the hand surgery education. One of the challenges that faces teaching is the availability of expert content and expert personnel to help learners learn anytime, any place, anyhow. And this is the basis of the modern, universally accessible, just in time learning. The result of this, we designed this study using the design thinking framework where we had an empathy and feeling for both the learner and the teachers. Teachers' times, especially clinicians, are busy with work. At the same time, they have to teach, and students may not have free time when the surgeon is available. So, this kind of lack of synchronicity gave us the impetus to find and ideas to help to provide learning materials anytime, anywhere, whenever the student wants. This brings upon online learning as a strategy, and we experimented with various tools, and we found ChatGPT, the paid version, provided an opportunity to design and develop a tool that would be able to provide teaching and learning anytime, anywhere. We collaborated with partners, both learners and teachers, and with technology individuals to create this product. So the whole design development project was like a DDR research, which is a quite a popular tool in instructional design and technology. After identifying our problem, we had a concept development by the use of an AI chatbot, since the use of ChatGPT and other open AI products and large language models. We had looked at Notebook LM and ChatGPT. However, in our design, we decided to follow MyGPT, which is a ChatGPT AI assistant creation program. We prototyped and tested it, following which we rolled it out among a small pilot users, and this is the result of that rollout. So the solution is called Hand Surgery Companion. We use MyGPT, which is a marketplace for the creation of AI assistants by OpenAI platform. This is how the configuration was done. We put in the prompt into the creation of MyGPT. This requires no technological knowledge in terms of coding, but however, you must be able to understand prompt engineering and put in the appropriate prompt. We took a Socratic method in the design of the prompt, in the sense that the teaching should not be just giving answers straight away, but to encourage reflective and critical thinking on the part of the students, trying to encourage a higher order thinking and more satisfying educational experience with the use of the chatbot, not just regurgitation of facts. And what we found in our early validation study was that this was very acceptable, the validity and reliability of the content, where we used 5 standardized prompts, and the content were marked by 5 experts. The usability score with using the SUS scale was very more than accurate. Here is a demo of Viva being conducted by the bot.
Clinical reasoning is a great way to learn. Let's go case style then. Imagine a 38-year-old office worker comes in saying they've had numbness and tingling in their thumb, index, and middle finger for a few weeks. It's worse at night and sometimes wakes them up. They also mention dropping objects more often lately. To start us off, based on this story, what's the most likely nerve involved and what clues point you that way?
I think it's the ulnar nerve that's involved.
Nice try. You're definitely thinking along the right lines with nerve involvement. But let's take a step back. The thumb, index, and middle fingers are mainly supplied by which nerve? And does the ulnar nerve usually cover that area?
I'm not sure. How about, could it be the radial nerve?
Fourth one. What's the name of the test where the patient holds their wrists in flexion, back of hands pressed together to reproduce symptoms?
Phalen's test.
Exactly right. You're very welcome. You've done a solid job working through this really impressive clinical reasoning. What topic are you thinking about tackling next?
So you can see that on the evaluation of the AI tool that it had high usability, pace and content validity was strong, and it was reliable. So the bot was educationally relevant, it has a good user experience, and it has been validated by experts and therefore can be rolled out for use. So we believe that this chatbot has got usability and utility, and we look forward for feedback from others. Thank you and have a good day. Bye.